Isn't hydroxychloroquine a safer alternative to prednisone? Is it a safe substitute for prednisone? If so, why is it so hard to get a prescription? That's what a prednisone warrior reached out to me today to ask. So I thought I'd make a video about it because I've never really made one specifically about hydroxychloroquine versus prednisone and why it might be hard to get a prescription. So this prednisone warrior goes on to tell me a few more details. I'm 75 years old. I've been getting very painful injections every 2 months from a pain doctor who says he cannot prescribe it to me unless I go see a rheumatologist. I don't understand why not. He has all my blood work, even an MRI from the waist down. The shots last for a while, but not long enough, and I dread going for the next one. In the interim, the doctor gave me a prednisone, which helps immensely, but he refuses to let me keep taking it, telling me of all the awful side effects. But I can't even walk down the street to one city block to the grocery store. I feel like $1,000,000 with the prednisone. I'm a widow who lives alone, and I do not have anyone to take me anywhere when I need them. Of course, everyone has their own life to live, and I hate having to depend on anyone. Certainly, taking prednisone is worth the risk to me for quality of life. I mean, who knows how much longer I have to live with this pain every day and not able to do the simplest things for myself. I did not have any side effects from the prednisone. He allowed me to have 2 months supply of 10 milligrams, but will not prescribe anymore. Okay, so let's talk about hydroxychloroquine. And the hardest part for me with this is I don't actually know your diagnosis. You never mentioned that. And so it's tricky for me to fully give your answer because while hydroxychloroquine might be a great option for certain diseases like rheumatoid arthritis or lupus, for other conditions, there's not great evidence or it would be different whether the benefit is actually there. Not all conditions have benefit from hydroxychloroquine. So hydroxychloroquine, when I was learning all about it in pharmacy school, it was called Plaquenil. It is not a steroid like prednisone, but it is an immunomodulator. Means it works by calming down your immune system without completely suppressing it like prednisone does. It's usually considered safer than prednisone, like you said, for most conditions because it doesn't have the same side effects like severe blood sugar issues, osteoporosis, and eye complications from prednisone. However, hydroxychloroquine isn't something a pain doctor typically prescribes for several reasons. First is that it's very slow acting. It usually takes 2 to 3 months for it to fully kick in. So even if your doctor prescribed it today, you'd still need other medications to give you the pain relief until the hydroxychloroquine kicks in. It's more of a maintenance medicine for chronic long-term conditions and definitely is not going to help short-term. Other reasons include typically the only doctors who prescribe hydroxychloroquine are rheumatologists because the drug can cause some rare and serious side effects that most other doctors aren't used to monitoring for. They don't have the systems in place to do that monitoring. And what we're looking for are things like eye complications. A rare but serious side effect is retinal toxicity. And so you'll need an ophthalmologist to be following you, and a rheumatologist already has a relationship with that eye doctor, and they can set up that referral really easily. Other side effects that you might experience from hydroxychloroquine include gastrointestinal issues, nausea, diarrhea, stomach cramps, skin reactions like a rash or itching, increased sensitivity to sunlight, and rare but very serious skin reactions like Stevens-Johnson syndrome. Muscle and nerve problems like muscle weakness, tingling or numbness in your hands or feet, and rare hearing loss or tinnitus. Heart rhythm changes are rare but can be very serious. Irregular heartbeat, palpitations, dizziness, or fainting. Rare blood disorders that need to be monitored for. Fatigue, frequent infections, bruising or bleeding. And finally, rare mental health side effects like anxiety, depression, insomnia, or hallucinations, even psychosis. So I get why your doctor is restricting your use of prednisone. He's concerned about osteoporosis, diabetes, weight gain, cataracts, glaucoma, infections, muscle wasting, and many other, up to 150 other side effects. I definitely advocate for people to do all that they can to minimize the side effects of prednisone, by getting on the lowest effective dose for your condition. And 0 is clearly not the lowest effective dose for your condition. But I get that your doctor is worried about the benefits and risks, and he's mostly worried about the risks of treatment. Like you said, it doesn't sound like he's really taking into account your benefits. You're really having great success with this medication. You feel like $1,000,000. It's allowing you to walk to the grocery store and be independent. Those are tremendous, fantastic benefits. And these other side effects, you said you didn't experience them. Though the longer you're on it and the higher the dose, the more likely you are to experience them. But is that better than being stuck at home, unable to walk? That's a really good discussion to have. And maybe you can find a different doctor. Like he mentioned, he wants you to go to a rheumatologist. And I know sometimes rheumatologists have a waiting list of 6 months before you can see them. But maybe a primary care doctor, a general doctor can help temporarily to get you prednisone. I'm always about getting a second opinion. I have gotten many second opinions in my life because I need help and I need it fast and I don't want to wait for that office to open and I want the best care for myself. So do not be afraid of advocating for yourself. And depending on your condition, there might be other steroid alternatives that aren't prednisone, but I just don't know what your condition is. So I can't tell you what those are. I have made lots of videos about alternatives to prednisone, so you can check those out. To summarize, hydroxychloroquine is generally safer than prednisone, and it sounds like prednisone treatment in your situation makes a lot of sense. So weigh those risks and balances with a doctor. I'd recommend finding another one and see if you can get the care you need by communicating fully. Look, I can be independent, function on my own, and I haven't had side effects. Let me have it. And get on the lowest effective dose that's giving you the pain relief. If you're still here, check out my video all about alternatives to prednisone. All right, signing off as Dr. Megan, your prednisone pharmacist.